Hello, my name is Anurag, and this is a poster I made as part of my master's degree in Neuroscience and Neurodegeneration from the University of Sheffield. It is titled Aducanumab, Mechanism of Action and Effects in Alzheimer's Disease. Alzheimer's disease is the most common form of dementia which can affect a person's cognition, memory, functional abilities, and behavior. Classically, there are two primary hallmarks of this disease: amyloid beta plaques and neurofibrillary tau tangles. Amyloid beta in particular causes neurodegeneration by tau hyperphosphorylation, oxidative stress, and neuroinflammation. An IgG monoclonal antibody called aducanumab was controversially approved by the FDA in June 2021 as a disease-modifying agent for Alzheimer's disease, although it was rejected by the European Medicines Agency. The timeline surrounding these trials can be seen here in Figure 1. As can be seen in Figure 2 here, aducanumab is thought to work primarily by binding the aggregated form of amyloid beta, which is a protein that is formed when a membrane protein called amyloid precursor protein is inappropriately cleaved by beta and gamma secretase. This drug has also been shown to cross the blood-brain barrier in preclinical studies, promotes clearance of amyloid beta by microglial phagocytic mechanisms, and prevents secondary nucleation. After the phase 2 PRIME trial, two phase 3 randomized controlled trials in 2015 assessed the efficacy of aducanumab use in mild Alzheimer's disease. These were the ENGAGE and EMERGE trials. Their primary endpoint was the slowing of cognitive decline as measured using the Clinical Dementia Rating Sum of Boxes, or CDR-SB, with multiple additional secondary endpoints. While a futility analysis in the early stages of the trial dictated that the primary endpoint will not be reached, it was later declared incorrect by Biogen, and it was shown using data from EMERGE that there are significant improvements in cognitive decline using the CDR-SB when the higher dose is used. This result was not corroborated by the ENGAGE trial, and other secondary endpoint improvements in ENGAGE included a lesser decline in MMSE, ADAS-Cog, and the ADCS-ADL-MCI. In particular, both trials showed a marked dose-dependent decrease in amyloid PET standardized uptake value ratios, as can be seen here in Figure 5. This suggests a decrease in beta amyloid accumulation over time. Another phase 3b study called EMBARK is currently ongoing, and a phase 4 trial called ENVISION has also commenced, with results projected to release in 2026. As shown in Table 1, the adverse events experienced by the participants were higher in experimental groups. Common side effects included headache, fever, fatigue, and amyloid-related imaging abnormalities, or ARIA. Figure 3 here shows two MRI scans with two types of ARIA. My references can be accessed by this link or using the QR code at the bottom. I'd like to thank you for listening to my presentation.